When I found out I was going to be a parent, I immediately felt a lot of anxiety and worry. So I went on to BetterHelp to try to look for a therapist to help me with that.
My relationship with my family and with my boyfriend and with myself were suffering. I really needed help.
I was ruminating a lot. Really getting those thoughts out to a therapist and getting feedback was just life-changing.
Discover what BetterHelp Online Therapy can do for you. Visit BetterHelp.com today.
Geez, I move in a few weeks and I just realized I have exactly 0 moving supplies.
First big move?
Uh-huh.
I've been there. Rented a truck, scrounged around for boxes, bribed people with pizza, still lost a chair, strained my back, and my friendships.
So, what you're telling me is maybe it's smart to hire a pro because I don't know what I'm doing.
That's actually why I used Mayflower. They walked me through everything. What to pack, what not to, when things would happen. It was weirdly calming. We had a move coordinator, real movers. They handled the heavy stuff, the timing, all of it.
That sounds very adult.
Trust me, Mayflower made my first big move exciting instead of terrifying.
Moving is a big step. Trust Mayflower to make it a confident one. Get a free move quote at mayflower.com. Mayflower, with you every step of the way.
Welcome to Unbiased Science, where we bring scientific method to the madness. I'm your host, Dr. Jess Steyer, and today we are talking about adult vaccines. Now, we talk a lot about pediatric vaccines, vaccines recommended for our kiddos. Those are also extremely important, but we tend to talk less about adult vaccines, which are equally important. So we have a very special guest joining us to talk about it. I will introduce her in just one moment. Before we do, a quick public health update for you all is that just yesterday, we're recording this on June 12th, the American College of Obstetricians and Gynecologists released its 2026 maternal immunization schedule. So ACOG's maternal immunization schedule provides evidence-based vaccine recommendations to protect U.S.-based pregnant, postpartum, and lactating patients and their infants from vaccine-preventable illnesses. It's been endorsed by 13 of the leading medical organizations in this country, including AAFP. And spoiler alert, our guest today is from the American Academy of Family Physicians, AAFP, as well as the American Academy of Pediatricians and others. We're going to link to it in our show notes. And a reminder to you all that we share updates constantly on our social media pages, as well as via our Substack. And we even do a bi-weekly vaccine policy series with our partner, the Vaccine Integrity Project. We will link to it in our show notes. We'd like to thank the American Academy of Family Physicians for sponsoring today's episode and helping us bring awareness to adult vaccines. Without further ado, we'd like to introduce Dr. Sarah Nosal.
I'm president of our board of directors, and I'm president of the American Academy of Family Physicians, which is 124,000 family docs, residents, and students throughout the United States.
Well, thank you. That was so beautifully said. She is also Vice President for Innovation and Optimization and Chief Medical Information Officer at the Institute for Family Health, a federally qualified health center network with more than 25 locations in New York State. She is also assistant professor in the Mount Sinai Department of Family Medicine and Community Health, where she focuses on care of marginalized communities and the uninsured, and continues as medical director of New York State's first student-run free clinic. How cool is that? That is amazing. A member of the AAFP since 2004, she has served as chair of the AAFP Commission on Membership and Member Services and chair of the Commission's Special Constituencies Subcommittee. Dr. Nosal is board certified in family medicine by the American Board of Family Medicine and in clinical informatics by the American Board of Preventive Medicine. She has the AAFP degree of fellow, an earned degree awarded to family physicians for distinguished service and continuing medical education. Sarah, thank you so much for joining me today.
Thank you. I'm really, really happy to be here.
All right, so I got to tell you, we opened up a Q&A box on our social media pages, and we asked folks, do you have questions about adult vaccines? And I was shocked. We received over 1,000 submissions.
Awesome.
Isn't that so cool? So people have a lot of questions. So we're going to pick your brain today. So we're going to cover all the things. We'll talk about shingles, HPV, flu, COVID, RSV, meningitis, chickenpox, adult boosters, childhood vaccines, and more. So let's see. Can we jump right into it?
Let's go. Yeah, my favorite topic. So I'm ready.
All right. So, well, first of all, a little birdie told me that you have some experience with shingles. And like I said, this is something we got a ton of questions about. Can you share a little bit about your personal experience?
Absolutely. So like many people my age-ish, we may have had chickenpox when we were young. I did. My two sisters and I all had chickenpox. And right after I started practicing as a family physician, one day I had like a soreness at the back of my neck. And then I kind of noticed there was another bump. And I actually didn't know what it was because it was someplace I couldn't see. It was back here. And I thankfully lived in the building with another family doctor who I said, can you just come by my apartment? And she's like, you have shingles. Now, shingles is contagious. It's contagious through touch if you haven't had chickenpox before. So we really think about how important it is if you have shingles to keep it covered, to let someone know who is, particularly someone who is pregnant or maybe trying to get pregnant, and someone who may not have been vaccinated yet, a newborn baby. You could actually give them chickenpox from your shingles. So one, that is really important. Now, I was too young in my 20s at that time to have yet received the Shingles vaccine, which is now what's recommended to prevent shingles. I cannot wait till I get to be 50 and I will make sure I get it again. So even though I had shingles, I luckily was a little bit younger. It wasn't as bad as it can be. It is an excruciatingly painful rash, particularly as you get older and further along. And it is one of the things that as older adults who have it may have pain for the rest of their life if they get the shingles outbreak. And so the vaccine is really the thing you want to do to prevent it.
Okay, so round robin questions about shingles. First up, do I need the shingles vaccine if I had the varicella chickenpox vaccine as a child?
Great question. When you were a kid, you were protected by the varicella vaccine. Now, as an adult, you want the shingles vaccine to protect you from an outbreak of shingles. They are going to work at different times in different ways in your life.
Next question. And you kind of already answered this, but if I already had, well, maybe not. If I already had chickenpox badly or had shingles young in my 20s or 30s, does that change whether or not I should get the vaccine?
While it probably gave your immune system a boost, like I probably am a little extra protected, I want the full protection of the vaccine that we know has been studied and works completely. So I'm going to get both of my Shingles vaccines when it's an option for me. And that's what I recommend to my patients.
Now, someone asked, is 40 too young to get the vaccine? When should you get it and who actually needs it? And maybe are there reasons that some people should get it sooner?
Great question. For the majority of individuals who don't have an immune compromising condition, it's going to be 50. For people, I take care of people living with HIV, people who have certain types of different immunocompromised conditions. Those individuals may be more vulnerable, and you should ask your family doc. I recommend for those patients, we often start even as young as 19, depending on what their risk is.
Oh, wow. Okay, interesting. We also got a question, any specific recommendations regarding shingles for adults over 65?
That's a great question. I don't know that I would make a different recommendation, but I would have to look at the guidelines to double check to make sure what their recommendations are. Many things are based on how long you have to live, how long we think it's going to be, or what's been studied. But I would look it up to tell you for sure for over 65.
Okay, next question is about 2-dose durability. So if it's recommended at 50, do you need a booster later for continued protection?
So it's not that it's a booster, but the actual series, just like when we're a little kid and we say, oh, you're going to get 3 shots of this vaccine to be fully protected. The recommendation for the current vaccine that's out, which is Shingles Vaccine, is that you're going to get 2 shots to be fully protected. And so that's not really a booster. It's just you've completed the series. And at this time, that's what we believe will keep you protected.
Now, Sarah, correct me if I'm mistaken. Shingrix, you said, that's the current vaccine, right?
Correct.
But there was a different vaccine that was previously recommended. And my understanding is that our current vaccine, Shingrix, has really great lasting protection. Yep. Is that right?
It is stronger. And we know that even if you got what was called Zostavax in the past, one, great job, you got it. You already gave yourself some protection when we didn't have another option. But as Shingrix became available, we really realized that if you complete that full series, even though you got that other vaccine before, if you complete that full series, your protection will last longer, be more effective, you're less likely to have shingles. And we know how uncomfortable and devastating it is without having vaccination. So really worth it to still get the complete series of Shingrix.
Now, something that we get this question a lot, or a comment question, that some folks have been delaying getting this vaccine because they're concerned about side effects. They've heard that it's quote unquote brutal. Can you talk about that and maybe allay some concerns?
Absolutely. So one, all vaccines, like at a minimum, I'll tell my patients pinch and a burn at a minimum, right? We're putting a needle in your arm. It is not nothing, but it is so much less than usually whatever, we're preventing by getting vaccinated. Also, there are some vaccines that have more robust immune responses, meaning that you're more likely to maybe get soreness or some fatigue or even feel a little warm. Often not a fever, but feeling like, oh, am I getting sick with something? You're not. Your immune system is sort of kicking in and learning to protect yourself from what was in the vaccine. And I would say Shingrix is one of the vaccines that you will have a more robust immune response. So for some of my patients, that might mean, hey, can I make an appointment on a Friday? Because I'd rather just know that if I'm feeling not 100%, I would like to have a day where I'm not running around or in the office. It is perfectly safe. I have received all of my vaccines while I'm working and seeing patients throughout the day. So really, most of the time for almost all vaccines, this isn't going to be an issue that impedes your ability to work. But if that's a concern for you, talk to your family doc. We want to make this work for you, for your schedule, for your family, and just what you feel the most comfortable with.
Fun fact about me, I don't know if this makes me a little weird, but if I'm getting a vaccine, and I get all my vaccines, of course, I actually like when I have a little bit of a reaction, because for me, it's like, you're telling me that my body's telling me that it's working. Of course, all of our bodies respond differently, right? So what happens to me might not happen for someone else. But anyway.
I feel the same way. And I did have a pretty robust response to some of my particularly initial COVID vaccines. Yeah. But my mother, who had no reaction at all, also was equally protected. So I think that's important to know, that if you're someone who has no response, you're like, did the vaccine even do anything? It's in your body working. Just everybody's body behaves a little differently when it receives the vaccine.
Now, one final question on shingles, and then we'll move on to HPV, which was another hot topic. But okay, so someone said that they forgot the second dose. Can they still get it?
Yes, you do not need to restart the series. Go ahead and get that second dose. Let's make sure we get you the full series so that we have you protected optimally. It's great if we can do it in the timeline, but if we haven't, we can still catch you up with that second shot.
Love that. Okay, great. All right. So HPV. Now, Sarah, I've talked about this often. I've written about this. I had HPV, and I wish I could jump in a time machine and go back and get the HPV vaccine. I was in my 20s. I was already sexually active when the vaccine became available. So anyway, I can't say enough. My son, who he's turning 10 this year. At his next visit, we are getting him his first his HPV vaccine, and then my daughter will get hers.
I started at 9 with my kids.
Amazing. Yes. Yeah. Well, he is 9 now. It's just a matter of when we scheduled his visit. So yes, 9. All right. So first question, we receive this a lot, is there a benefit for older adults, or like what should the considerations be for adults who have never received the HPV vaccine? So
I want to start with adults who are under age 26, because I think that's a really easy group to know there's a benefit. So HPV vaccine actually has a number of different HPV virus protections in it, some of which cause HPV related cancers. So I think of this as a cancer vaccine, and how cool is that we have a vaccine that prevents cancer. And so I can't get over that. And that's why I was so excited for my kids to get it. There are also HPV viruses that cause warts, and we have that protection there too. And so those are like amazing things. We know that by the time all of us grow up, we will all have been exposed to HPV of some sort. And this vaccine contains the most common HPV viruses that we'll be exposed to. So if you are under 26, it is a no-brainer. Go and get your HPV vaccine. You absolutely are going to benefit, and the studies show you that. And so if you are if you're 9 and you have a parent like I am, you're going to be brought in by your mom right away to get your vaccines and make sure that you're protected, because I've seen the devastation that I've seen in throat cancers and cervical cancer, rectal cancer, that we now know are actually preventable through HPV vaccination. So that group, easy. Now we're still talking about other adults. So we actually can till 45 consider vaccination. Like yourself, if you already had HPV, which so many adults have already been exposed, we're not going to gain protection from getting that vaccine after the fact from that particular strain of HPV. But as I said, there's multiple HPV strains that you're being protected from in the vaccine. And that actually, if you haven't been exposed to one of those, you may still benefit and have protection. It's a talk with your doctor, because it really means what's my risk? So I've already had an HPV exposure and had a risk. That might be a person who makes more sense, because some people's bodies are more vulnerable to HPV than others. We don't know why. Also, my patients who are living with HIV are a really good population to think about who might benefit. That those individuals, we have an opportunity to take action there. And so really those individuals, I have a discussion. I say, even though you're past where we know full effectiveness may be there, you still may benefit. Let's consider this. Oftentimes my patients say, yes, it's worth it. Who doesn't want a cancer protection vaccine?
Now we do get some follow-up questions then about coverage. And please correct me if I'm mistaken, under 26 is typically covered.
Should absolutely be covered if you have insurance. That in this country, because it's recommended standardly, should be covered.
But that 26 to 45, my understanding is that maybe not all the time, and that might be something that you want to.
It should technically be covered, because it's under the idea that you would make a shared decision in the guidelines. But I would tell you that has not always been the case, and for that reason, sometimes your doc might have you actually go and get the vaccine from the pharmacy and bring it to our office, or you may receive it sometimes at a pharmacy, depending on how your insurance works. And sometimes you may end up paying out of pocket. I would say that it is definitely well worth it. And if we get the opportunity to vaccinate our kids when they're young, they get 2 vaccines. As you get older, you end up with a longer series and more doses.
Mm-hmm. And so just one more thing about my experience. So I had precancer cells. I had to go for a colposcopy, which is basically like a hole punch of my cervix. Mm-hmm. Yeah, if I could avoid my, my goodness. And as you said, we have a cancer preventing vaccine. I mean, it just blows my mind. Anyway, okay. The next question that we receive quite a bit is about, I'm in a long-term monogamous relationship. Mm-hmm. Should I still get the vaccine?
So that's a great question. And I would tell you 100%. So they did these studies when they were studying the HPV vaccine. They were testing just skin cells under the nails of teenage boys. And they had HPV under their skin cells, so HPV is kind of everywhere in our environment. You don't have to have been having penetrative sex. Mm-hmm. You don't have to have been having, you could have any type of relationship interactions. We can be transmitting HPV to each other relatively easily. In addition to that, your partner may have always been negative for HPV, and it ebbs and flows. Sometimes HPV shows up and sometimes it doesn't. And so it is not necessarily a one-to-one relationship. Often I have patients who have uteruses, vaginas, who are getting pap smears, who get a new HPV, and they're like, is it my partner right now? And I can't tell you that it is. You might have gotten HPV 15 years ago, and we don't know where, how, and what form of skin touch could have caused that HPV to end up being present there. So I would tell you that this is such a low risk vaccine with such a high benefit that if you are still eligible, it's not too late. Definitely worth getting and preventing all the types of HPV that we know can end up in throat, rectum, vagina, all of them worth not having.
Mm-hmm. And maybe I'm also being a little bit of a Debbie Downer here, but life happens, things could change.
Absolutely.
And, better to get it, set it and forget it, right?
Absolutely. 100% on board.
Okay. What if you don't know if you had it when you were a child?
If you received the vaccine?
Exactly.
So that's a really common question that comes up. People are like, I don't know. My mom has my records. One, ask your mom. Your mom might know what vaccines you received. Also, the year that the vaccine came out, which I don't have on hand, but we can definitely look up for you. Your family doc can help you know if you got vaccinated in these years, how likely it is that you receive that vaccine. And that also that it is not harmful to receive additional vaccines, but I'd help you dig through your records. We'll get some of your old, visits from when you were of age when the vaccine would have been available, help figure out if it's been there. But for HPV, it is really relatively low risk. I would encourage you to complete the series, even if you are uncertain and we can't get your records from anywhere.
All right, let's move on to flu.
Great.
So folks had a lot of questions about when is the optimal time to get the flu vaccine.
When you have it available to you during flu season. So I myself tend to get it a little earlier because I'm a family physician. We have a big, amazing conference every year that's in either September or October with thousands of other family physicians. And guess what? That is prime flu COVID season, right? Those are viral illness seasons. So I know, because I know I'm going to be exposed in that I try to get my vaccine 2 weeks prior to that. So if you have a big family event, if you're all going to be getting together during viral season, it might make sense for you a little bit earlier. Usually we say late September through the end of October is ideal because it's going to kind of then carry you through what's the typical flu season into like the very, late winter, early spring of the next year. And so that's usually what we encourage. But if I have a patient in my office, I know you're not going to get another day off from work because it's the beginning of September, or because it's in November, you're still going to benefit. Please let me, let's talk it out. Let me make sure you're ready. And right now, it's summer now, it's hot out. Every patient I'm seeing, I'm talking about when you come back, we're going to have the latest flu and the latest COVID vaccine available. I want to let you know I'm going to be encouraging you to get it. Do you have questions now about planning for that? And they're like, oh. I was like, don't worry, there are no needles today. Let's just talk it through today to get you ready. And I think that this is a great opportunity. Like for listeners, if you have a good family doctor you're seeing regularly, talk to them now. So, is it worth it for me? Am I one of the populations that should be thinking about getting both flu and COVID in the fall? Those are really great to help you prepare. We don't like to be surprised when we show up that we have some procedure, some vaccine we didn't know was coming. And it makes a big difference when you kind of can plan for it and make decisions and know what questions you might have as you hear information and you're preparing for your visit.
Psst, in here, right inside that throbbing headache resting on your pillow. It's me, your hangover. And that oh so queasy feeling I'm giving you is actually a reminder that you made the right call last night. And to be clear, I'm talking about the call to the rideshare service who sent a sober driver to get you home. Not the call you made to your ex. That was the wrong call, girlfriend. That was the very wrong call. Before you drink, plan a SoberRide.com. Brought to you by the California Highway Patrol's Designated Driver Program.
Your package says delivered, but delivered where exactly? The hallway? The lobby? Your neighbor's apartment? Instead of playing detective with your deliveries, get a mailbox at the UPS store. We'll sign for your packages, text you when they arrive, and keep your deliveries low-key under lock and key. Get 3 months free mailbox services with a new annual agreement at the UPS store. For full details and to get your coupon, visit theupsstore.com/offer.
Also, y'all, can we please stop saying just the flu? I mean, Sarah, can you talk to, I'm sure you've had patients who've been, gotten severely sick from flu, hospitalized, even tragically died.
I have, absolutely.
Okay. So I just, the minimization of flu.
There's no such thing as just the flu. I think I also have a lot of patients who say that they don't get sick with the flu. And that may be true. And I am thrilled if you don't have bad symptoms when you get the flu. However, every baby that you're near, every pregnant person, when you go help your grandma during that season, because, you're helping set up the tree at her house or you're going to services together, you have now, even though you have no symptoms, you're actually shedding virus. And you have now exposed really vulnerable people you love and care about, who you would do anything for. And you miss the opportunity to do the one thing, which was to be vaccinated and not bring to them the influenza virus. And for them, it might be devastating and life-altering. And so even healthy young kids can end up hospitalized in the ICU. We don't totally understand why. This kid who literally has these robust immune systems, my patients say, my kids are healthy. I'm like, that's the scariest, that those are the kids who end up sometimes really sick. And that we definitely know our older adults are immunocompromised individuals. The pregnant people who they devastating illness. It's the most vulnerable time. And we want healthy moms and babies. And this is such an opportunity for us to give that gift to all the people we really care about. So even if you don't get sick, take advantage of the flu shot, protect your community.
Absolutely. What would you say if you heard someone say, well, every time I've gotten the flu shot in the past, I got the flu, but when I skip it, I've been fine?
So I always promise my patients they can come back and punch me in the arm if they get sick after the flu shot, because I tell them there's no way that they absolutely are not getting the flu ever from the flu shot. That doesn't mean they're not having that immune response we were talking about. And you know your body. You might know, like, oh, I always get a little bit warm, or I feel a little bit under the weather. But if you're having coughing, runny nose, none of that was caused by your flu shot. But you know what? It was caused by the hundreds of people around you who are already sick with other regular viral illnesses every single, cold and flu season. And so that time of year, it is very likely, I promise, you're going to have another cold probably during cold and flu season. But if you get your flu shot, it'll be very unlikely that it's going to be influenza. And so as I go through, I have the benefit, I've been taking care of my patients for 20 years. We can go into their electronic health record and I've said, they say, I get sick every time. I said, let's look through your chart and see if you got sick after your flu shot. And when we really go through, they realize, oh, okay, maybe I didn't. Like I haven't gotten sick afterwards. But it's a bias in how our mind works. It's not your fault. It's not my fault. When it's raining out, we think arthritis hurts more. It's just that our memory works better in about certain things. And we remember getting that shot. And then when we get that cold, from something else, we attribute it to the wrong thing. But your flu shot is protecting you. It cannot infect you.
Last thing on flu, we get a lot questions about the effectiveness of the vaccine. And people will cite how, some years it's quote unquote, only 30-something% effective, and, can go up to, let's say, like 60% effective in other years. I often say to people, well, 30% protection is better than 0% protection, but for sure. I'm curious how you handle that with your patients.
I think there's several different levels. So one, we all would love to not get sick at all, right? And so sometimes the flu vaccine can't do that. Sometimes the flu vaccine is decreasing our symptoms. So we miss less work. We shed less virus. We're less likely to make grandma sick. We're less likely to make our best friend who we're going to their baby shower sick. And that really matters, even if it doesn't 100% prevent us from getting ill. Also, oftentimes, even when it doesn't prevent infection, it prevents death and hospitalization. So particularly for children, but actually older adults as well, and adults in general, we've seen that even in years where the flu vaccine is not quite as effective as it's been before, it means kids didn't die. It means that older adults weren't hospitalized. That's huge. Not having my mom end up in the hospital is well worth it. And if she's home with a little bit of a runny nose and not hospitalized, I am so grateful that she received that vaccine. And I think that this idea of 100% protection isn't going to be there with the flu shot, but it is really going to have substantial protection for the things we worry about, which is keeping our loved ones around.
All right, moving on to COVID. So a couple of questions about COVID that were very common. First of all, do you really need to get it annually like the flu shot?
So at this time, we do recommend, particularly for older adults, for adults in general, and for people who have like other severe chronic illnesses, that annual is the way to go. That we're still updating the COVID vaccine like we do flu to reflect how the virus changes every year. And so part of my conversation this week, just yesterday with my patients in the office, was that we know there were some COVID viruses that were a little different that were in the community just like the last few months. And that if that fall new vaccine comes out, has those new strains, that I said, I want you to know I'm going to be pushing harder than last year. I'm going to be pushing even harder, even though I recommend it every year, that really people consider it. Because we know that we got some good protection when you got your original COVID vaccines, and if you had COVID infection since that time, that you have some good protection in your body, but not enough for some of these new variants that come out, particularly if you're older, particularly if you're pregnant, like these really vulnerable populations. And if you're going to be around all of those people, that our goal would be to protect ourselves from these new variants that might have a more robust response in us. We might be much more sick if we get infected, and we would want to have the vaccine to help protect us to fight against it.
And what about, can we get the COVID shot the same time as the flu vaccine? I always get them both in my non-dominant arm. That's my choice. I like them both there. I know that arm's going to hurt a little. That's okay. I take a little
acetaminophen or naproxen, and I do just fine. And I recommend the same. I do it. I go to work that day. I see patients. So I do not, it hasn't interfered with my ability to enjoy the rest of my day, do the things that I love taking care of patients, but definitely worth it. One trip, same time, and they both work really well.
Now, rounding out the big three respiratory illnesses, let's talk RSV. The theme and the questions is this a new vaccine? What is the actual recommendation? Who should get this vaccine?
I kind of think about RSV in sort of two different populations, because there's RSV that's really for older adults or people whose health is at risk, and there's RSV for babies and pregnant people. So if we first think about older adults, the year before the RSV vaccine came out, 2 of my patients were in the ICU with RSV. And I was so devastated that I hadn't been able to protect them. And so that following year when the RSV vaccine came out, I was really strong with my patients about how this was a great opportunity, that we'd been studying it, but it hadn't been available. And now it was readily available to protect. At that time, it was a little bit older age group, but now 50 we can start at, and 75 really for everyone over 75, and 50 if we have risk factors. A lot of my patients have chronic disease and risk factors. And that I had no patients end up hospitalized with RSV the subsequent year. So that's my small community, but we do know that the large data shows that
Absolutely.
Individuals who are getting their RSV vaccine. So for most people who are young and healthy, who are not in that group that it's recommended, if you get RSV, you might get a cold, but it is a devastating illness to your great grandma or your grandmom over 75. So this is a good question to ask your family before the holidays. Make sure they've had that vaccine once in their lifetime. Now, pregnant people, we actually found out that we can protect our newborns so that when we give birth, now RSV is this illness that has no treatment. It's really like if your baby gets this after they're born, their lungs are so tiny and just barely working that they just fill up with fluid. They're having difficulty moving air. We're giving oxygen. We're putting you under these little oxygen tents. They're so tiny. And we're just trying to keep you alive while your immune system tries to fight it off. Or while you're pregnant, that pregnant person can be vaccinated and protect you by helping transmit those antibodies to that newborn. And if we miss that chance during pregnancy for whatever reason, that we can actually give antibodies to the baby after they're born as well. So those are all opportunities to really protect these vulnerable kids, because these are deaths it's so devastating. There's nothing like a newborn that you have been doing everything right to have this healthy, beautiful pregnancy, and then have your newborn have this devastating illness that we can now prevent, which is amazing.
I wish the vaccine was available when I was pregnant with my kids. I have heard horror stories from my friends who are pediatricians about, infants, very young children being so extremely sick. So got it. So adults over 50 and during pregnancy.
Over 50 with risk factors, over 75, no question.
Got it. Okay, perfect. Thank you. Thank you for clarifying. All right, let's move on to meningitis. So people want to know, do adults need meningitis boosters?
So if you are planning a really awesome trip abroad, ask your doctor to check out where you're traveling to. So there are large swaths where there can be like meningitis belts on whole continents where actually during certain seasons, you really want to have gotten a meningitis booster, particularly if you don't know whether you received your full series or how long ago it was. So that's one of the most common reasons I give out the meningitis vaccine. Also for people living with HIV and other immune compromising conditions, or if you had a spleen, so traumas where you actually don't have the protection of the normal vaccines you received before, these are all people who may end up needing the meningitis vaccine. So if you've received your routine vaccines along the way, you are probably protected. You probably made sure to get your protection before you went off to school or to work when you were a young adult. But if you are uncertain, check in with your doc. We can help find that information for you.
Great. Okay, chickenpox and varicella. So lots of questions. I never had chickenpox as a child, nor did I get the vaccine. I'm 48. Can I get the vaccine? Can adults get the vaccine?
Can get the vaccine. So you may have had chickenpox and not known it. Some people had it really lightly. It might mean you don't have full protection. So many of us are working, like healthcare is the largest place where people are working. So I can tell you that I often end up vaccinating people who are going to be a home health aide, or they are going to be working in a hospital, or they're an ultrasound tech, a nurse, or a physician. Those individuals, really, we want to make sure that you are the most likely to be exposed. So we want to make sure you're protected. But any adult who's uncertain, take this opportunity. You don't want chickenpox as an adult.
No, it sounds awful.
It is awful.
And please don't have chickenpox parties for crying out loud.
No more chickenpox parties. I do remember those, but yes, no, not recommended.
Right? I remember those too. That's wild to me. The 80s were wild. Okay, so moving on to, we had a bunch of questions just generally about adult boosters for childhood vaccines. So sort of on this theme, are there any vaccines for which adults do need to get boosters from, childhood vaccines?
So there are some that we consider. And I also want to I think it's a little confusing because we also have some vaccines that just we keep up to date. So we talked about flu and COVID that every year we keep up to date. They're not boosters. They're a little different every year. So we're keeping that up to date. Also with tetanus. So tetanus has tetanus, diphtheria, and pertussis. That's the one that every 10 years we get. Or if we've had, an accident or gotten a puncture wound or a cut. So those we're kind of keeping up to date. Then we have some vaccines that don't necessarily need a booster, but we might realize a booster has become required. So mumps, measles, rubella, we are having a measles outbreak. Depending on when you were born, what year you received vaccines, you might want to receive an additional vaccine. Those are good recommendations. You're traveling abroad to an area where there's a lot of polio in the community. You might want to make sure that you get a polio vaccine. And those are things your family doc can go through the information with you and help make those choices. Hepatitis B usually doesn't require if you've completed and you have immunity. We talk about chickenpox if you're fully immune. The things that other vaccines we talked about, shingles completing the series, the importance of HPV completing the series, and pneumonia, which I didn't talk about much, but that's a vaccine that we are kind of making sure that people are receiving that's now available, and it can be a really big deal. Not so much a booster that there's a new version that comes out that's more effective. We want to make sure you get it, even if you got a pneumococcal vaccine before. You want to ask your doc, did you get the latest version? And it's not a booster so much as it's the new version that covers more risks for pneumonia and more protection.
And at what age can folks start getting that vaccine?
Again, this is one of those that depends on risk, but over 50 to start talking to your doc about it if you have no other risk factors.
Okay, we also got a lot of questions about getting vaccinated during pregnancy. A lot of folks who are saying that they're just concerned, can I feel comfortable that this won't impact my baby? Anything that you can share that might alleviate concern for pregnant folks?
I have a great friend who is a family doc and pregnant right now who has been putting out there on Instagram the videos of her receiving all of her vaccines during her pregnancy and which are the most important for protection. And so I would tell you that our goal is that we want it to positively affect you during pregnancy, and that's what it does. It's true, not all vaccines are recommended during pregnancy. We will guide you. Your doctor, your family doc is going to help you know these are the vaccines that actually make you protected, help protect your baby during your pregnancy. And there are some vaccines that will say that's not a vaccine that's safe during pregnancy. Just like we tell you there's some medicines not to take and some foods that are not as safe because of how we share things across the placenta of what can happen there. So would you want to get every vaccine? No. You want to get the vaccines that we know have been studied and are safe and actually really make a difference for good outcomes like flu, like the pertussis part of tetanus. When we get that Tdap vaccine, that means that your baby's not going to have this horrible coughing illness that is really common that babies used to have, and now we're able to prevent it. COVID, because there's such an increased risk of death for pregnant people who have COVID. So getting that COVID vaccine during that season will mean that your risk of complications is so much less. And now RSV, that we know we can both protect mom from transmitting to baby and protect baby after birth, which is amazing.
Okay, few other questions.
Absolutely.
Okay, so is there an adult vaccine schedule and where can I find it?
So great question. There is. I love the little colored, bars that we have for the kids. And I think people are like, where's my information as a grown-up? So American Academy of Family Physicians, we have a great vaccine site. You can head there, see the full schedule. It gives you the nice color bars, and it'll help you to identify am I at risk? Am I at risk based on age? Am I at risk based on other medical factors? Should I be considering, if I'm going to go see my sister who just had a new baby, should I be considering certain vaccines? And that information is right there on our vaccine hub. Please check it out. And then bring those questions to your own primary care doc, the person who's helping guide you and answer your questions about vaccines. It is appropriate that you have questions. We're at a really hard time in history where we're getting information from every direction. Family members that we trust might be saying things that we are uncertain about, and we need a trusted person to ask. And your family doc is there. We do not think any question is dumb. Every question is worthwhile. Every question is important. And if you're thinking it, I'm telling you, another dozen patients have asked me that question. And I'm so excited that I can share that information with you in our office.
And we will link to this, to the adult vaccine schedule in our show notes. It is fantastic. Thank you so much to AAFP for making it so easy for us. What about, how do I figure out what I've had versus what I'm missing?
So I would tell you that you want to start to dig out some of those old records that you have. Sometimes if you go to I go to my pharmacy's app online, sometimes be like, when, because I know I need a second Hep A. I wasn't immune to Hep A. I was getting my second Hep A. I know that's due sometime soon. I should look that up today. So you look on a patient portal, like for electronic health records, if you have a patient portal, if you have old school records, if you served in the military, even blood work for a job, oftentimes all of that information, you don't have to know what it means, but if you put that all together and you bring it to your visit, I will help translate that information to you. Your family doc will go through it with you, help you know if it shows you are immune in either from vaccination or blood work, or if there's some things that it looks like maybe you didn't get, maybe just even based on when you were born. A lot of vaccines like hepatitis B wasn't out when I was a little kid. So I actually, when I went to med school, got those vaccines for the first time. And so those type of things we're able to know just based on when you grew up and what time you would have received your vaccines.
Last question. Mm-hmm. We received the sweetest messages from a bunch of newly minted grandparents who said, is there anything, my grandbaby was just born. Is there anything I should get as a first-time grandparent just to be safe?
So thanks to all grandparents who are helping care for us after we've had our newborns. They're a huge asset to the family. So my sister required for anyone coming to the house and grandparents who are helping, Tdap, because you're getting that whooping cough protection for pertussis, the flu vaccine as we got to flu season, the COVID vaccine during COVID. She gave birth after all that fun. And if you are eligible, you should be considering the shingles vaccine, because that's something that can be transmitted, as we said, through touch, the pneumonia vaccine, and that RSV vaccine, because we know babies are vulnerable to that. And even if mom and baby, a pregnant person were able to get the protection, we still want to reduce the risk of exposure. So if you are in the age group where that's available to you, those are great opportunities, and to be an amazing grandparent. Thank you.
Oh my gosh, you are a machine. Thank you so much for answering all these questions. Any final thoughts or messages for our audience?
This is really part of my favorite part of being a family doctor. When we have an opportunity to use our most effective tools for prevention, and our patients really want to take good care. Our families want to take good care of everybody, every member of their family, the people in their house and their, cousins and grandparents and everybody in their community. It is such a blessing to be able to do this work. Please come in with your questions. Help me help you take good care of your family and community. And I'm grateful for the work that you do and that all of our community is doing in protecting each other. Thank you.
Oh my gosh. Thank you so much, Dr. Sarah Nosal, for joining us today. Thank you so much to the American Academy of Family Physicians for sponsoring this episode and helping us raise awareness about adult vaccines. It is so important. We will link to all of these resources that we discussed today on our show notes. Thank you so much to our audience for tuning in. We certainly hope you learned a thing or two. I learned a lot. And we'll catch you next week on your trusted source for no nonsense, just science.
Your team just added its 67th AI tool, and also your 67th security blind spot. The good news? The Vanta agent works like a GRC engineer in the background, finding every app your team uses, scoring the risk, and drafting fixes for you. Vanta is the platform used by over 16,000 fast-moving companies like Ramp, Cursor, and Harvey, who are shaping the future with AI and staying ahead of AI risk. Get started at Vanta.com.
Psst, in here. Right inside that throbbing headache resting on your pillow. It's me, your hangover. And that oh-so-queasy feeling I'm giving you is actually a reminder that you made the right call last night. And to be clear, I'm talking about the call to the rideshare service who sent a sober driver to get you home, not the call you made to your ex. That was the wrong call, girlfriend. That was the very wrong call. Before you drink, plan a SoberRide.com. Brought to you by the California Highway Patrol's Designated Driver Program.
If you like the show, please take a moment to rate, review, and subscribe. It really does help the show to grow. Thank you for listening.